please see important safety information and indication at 402.
The fear of epilepsy is the unknown. Nothing's getting better, and you think this is my new norm. I don't want that to be my new norm. I didn't want that to define who I was. Hi, I'm Shannon. I'm 44 years old. I live in Alexandria, Louisiana, and I've been dealing with epilepsy for 9 years. I'm a family man. I enjoy time with my kids. You have to be in your children's life to be able to raise them right. We like to hang out here at the house and go in town and have a nice meal every now and again. Work at the airport as a terminal superintendent. I'm outside, I'm talking to passengers on the planes. I'm a very social guy. My first symptoms with epilepsy, I honestly didn't know anything about them. I was having these spells, I guess you would call them, at work. I wasn't recognizing them until I was actually in an accident. That's when I decided to go get checked out. So I go to the first neurologist. I didn't have any recollection of anything that was going on, so I couldn't really give him any details. There were no tests run. It was almost like he was doubting in his mind what I was feeling. I took the advice of some friends and reached out to another doctor. We finally got down to the root of the problem, where my fatigue and stress were my triggers. When you get diagnosed with epilepsy, of course, you can't drive. So I was relying on one of my coworkers to come and pick me up. It kind of takes away that freedom of what you're used to doing. Once I started realizing that you could feel these auras come on, and you knew the guys at work had seen you do things that you didn't recognize, it was a sense of embarrassment. The unknowns that were the worst part of us. My kids seeing me have a seizure is scary. You're supposed to be the strong one. And when you're going through something like that, it's hard to look strong in front of your kids when inside you're not. One of my favorite things to do was to take my girls on date nights. When their mom doesn't trust you in a vehicle, you can't go. You just don't have your life. Living with epilepsy, you're striving to be seizure-free. My neurologist came to me with his nurse, knowing that the other two medications weren't working, and wanted to try XCOPRI. My first thought was, is this just another drug we're going to add that's not going to work? I wanted to get off of one of the medications just from the side effects. At the level that I was having my episodes, they couldn't really take me off of any of my medication. So after deciding to go with XCOPRI, I noticed there was a significant reduction in my episodes. I was hopeful that I could get my life back. I think it's very important to advocate for myself, but it's nice to have people that you can count on to have your back. Having a good doctor and getting someone who cares about you really takes a lot of stress out of what you're doing. If you have a good support system, that just makes it that much easier to maintain what you go through on a day-to-day. As a man, we don't share our feelings often. But there are times that I probably should have reached out before I did. Talk to your doctor. Don't be afraid to ask. Don't be afraid to try a different medication, because XCOPRI thankfully worked for me.
Important safety information and indication for XCOPRI, cenobamate tablets, CV. Do not take XCOPRI if you are allergic to cenobamate or any of the other ingredients in XCOPRI. Have a genetic problem called familial short QT syndrome that affects the electrical system of the heart. XCOPRI can cause serious side effects, including allergic reactions. XCOPRI can cause serious or life-threatening skin rash or other serious allergic reactions which may affect organs and other parts of your body like the liver or blood cells. You may or may not have a rash with these types of reactions. Call your healthcare provider right away and go to the nearest emergency room if you have any of the following: swelling of your face, eyes, lips, or tongue, trouble swallowing or breathing, a skin rash, hives, fever, swollen glands, or sore throat that does not go away or comes and goes. painful sores in the mouth or around your eyes, yellowing of your skin or eyes, unusual bruising or bleeding, severe fatigue or weakness, severe muscle pain, frequent infections, or infections that do not go away. Take XCOPRI exactly as your healthcare provider tells you to take it. It is very important to increase your dose of XCOPRI slowly, as instructed by your healthcare provider. QT shortening. XCOPRI may cause problems with the electrical system of the heart. QT shortening. Call your healthcare provider if you have symptoms of QT shortening, including fast heartbeat, heart palpitations that last a long time, or fainting. Suicidal behavior and ideation. Anti-epileptic drugs, including XCOPRI, may cause suicidal thoughts or actions in a very small number of people, about 1 in 500. Call your healthcare provider right away if you have any of the following symptoms, especially if they are new, worse, or worry you. Thoughts about suicide or dying, attempting to commit suicide, new or worse depression, anxiety or irritability, feeling agitated or restless, panic attacks, trouble sleeping, insomnia, acting aggressive, being angry or violent, acting on dangerous impulses, an extreme increase in activity and talking, mania, or other unusual changes in behavior or mood. Liver problems. XCOPRI may cause liver problems. Your healthcare provider will do blood tests to check your liver before you start XCOPRI and while you take XCOPRI if needed. Tell your healthcare provider right away if you have any symptoms of liver problems, such as yellowing of the skin and eyes, jaundice, nausea, vomiting, unusual darkening of the urine, or feeling tired or weak. Nervous system problems. XCOPRI may cause problems that affect your nervous system. Symptoms of nervous system problems include dizziness, trouble walking or with coordination, feeling sleepy and tired, trouble concentrating, remembering, and thinking clearly, and vision problems. Do not drive, operate heavy machinery, or do other dangerous activities until you know how XCOPRI affects you. Do not drink alcohol or take other medicines that can make you sleepy or dizzy while taking XCOPRI without first talking to your healthcare provider. Discontinuation. Do not stop taking XCOPRI without first talking to your healthcare provider. Stopping XCOPRI suddenly can cause serious problems. Stopping seizure medicine suddenly in a patient who has epilepsy can cause seizures that will not stop. Status epilepticus. Drug interactions. XCOPRI may affect the way other medicines work, and other medicines may affect how XCOPRI works. Do not start or stop other medicines without talking to your healthcare provider. Tell healthcare providers about all the medicines you take, including prescription and over-the-counter medicines, vitamins, and herbal supplements. Pregnancy and lactation. XCOPRI may cause your birth control medicine to be less effective. Talk to your healthcare provider about the best birth control method to use. Talk to your healthcare provider if you are pregnant or plan to become pregnant. It is not known if XCOPRI will harm your unborn baby. Tell your healthcare provider right away if you become pregnant while taking XCOPRI. You and your healthcare provider will decide if you should take XCOPRI while you are pregnant. If you become pregnant while taking XCOPRI, talk to your healthcare provider about registering with the North American Anti-Epileptic Drug (NAAED) Pregnancy Registry. The purpose of this registry is to collect information about the safety of anti-epileptic medicine during pregnancy. You can enroll in this registry by calling 1-888-233-2334 or go to www.aedpregnancyregistry.org. Talk to your healthcare provider if you are breastfeeding or plan to breastfeed. It is not known if XCOPRI passes into breast milk. Talk to your healthcare provider about the best way to feed your baby while taking XCOPRI. Common side effects. The most common side effects in patients taking XCOPRI include dizziness, sleepiness, headache, double vision, and feeling tired. These are not all the possible side effects of XCOPRI. Tell your healthcare provider if you have any side effect that bothers you or that does not go away. For more information, ask your healthcare provider or pharmacist. Call your doctor for medical advice about side effects. You may report side effects to FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. Drug abuse. XCOPRI is a federally controlled substance, CV, because it can be abused or lead to dependence. Keep XCOPRI in a safe place to prevent misuse and abuse. Selling or giving away XCOPRI may harm others and is against the law. Indication. XCOPRI is a prescription medicine used to treat partial-onset seizures in adults. Please see additional patient information in the medication guide. This information does not take the place of talking with your healthcare provider about your condition or your treatment. Please see full prescribing information and medication guide.